Welcome back across Nevada to Face to Face. It's a dubious distinction, one held by Nevada for 4 of the last 5 years. Domestic violence turned deadly for 35 women in 2009, more than any other state. Now, a group out to defend the president's health care plan says the Affordable Care Act can help prevent more victims of so-called intimate murder. Joining me from yourcare.org, Annette Ravaneau. Thanks for coming on the program.
Know your care.
Know your care. Did I say it wrong?
You have to know your care.
Oh, okay. You're just telling me to know my care. Okay. All right. We're going to get about what generally your group is going to do. But here's the issue. You're trying to protect the Affordable Care Act from all these attacks. I mean, it has been reviled. You guys essentially have lost the message war, in my opinion. So you sent out this press release saying that domestic violence screenings are covered by the Affordable Care Act. Well, are you just going to try to use any issue you can find to try to defend this? Because this seems like a bit of a stretch, no?
First of all, John, thank you very much for inviting Know Your Care to your show.
Are you going to say it every time you answer a question?
Well, because you said it wrong.
Did I say it wrong? I apologize. What did I say?
Your care.
Oh, I said no. I should have said Know Your Care. Okay, I'm sorry.
No problem. Well, we're a 501c3 organization, and we're dedicated to educating Nevadans about the Affordable Care Act
501c3 nonprofit, just so people know, right?
Correct. Yeah, we're a nonprofit. And basically, domestic violence is a huge issue here in our state. And as you know, 34 women died in 2009 as a result of this violence perpetrated to them. And Know Your Affordable Care Act, well, covers the domestic violence screenings and counseling in the new insurance plans for these women.
Let me show the national statistics. You mentioned the Nevada statistics from 2009. Nationally in 2009, 1,693 women were killed by men. For homicides in which the victim-to-offender relationship could be identified, 93% of female victims, that's 1,579, 1,693, were murdered by a male they knew. Nearly 14 times as many females were murdered by a male they knew, 1,579, than were killed by male strangers, 114. For victims who knew their offenders, 63%, 989 female homicide victims were wives or intimate acquaintances of their killers. There were 296 women shot and killed by either their husband or intimate acquaintance during the course of an argument. I can't believe that you think domestic violence screenings are going to stop most of those murders. If someone wants to hurt, kill their spouse, they're going to do it.
Well, most of these issues, first of all, don't start with him or whoever their partner is hitting them. First, it starts with arguments, you know. So if the woman has the possibility of having screenings, counseling with their health care providers, hopefully this will alleviate this issue. And so many women right now just feel trapped and they can't do anything. I mean, right now, John, you probably live next to a woman, or you probably know a woman that's going through this, and she simply does not feel comfortable by saying it. And a lot of women have already been denied health coverage because of this pre-existing condition, which is being, being in a domestic violence relationship, which, thanks to the Affordable Care Act, now the pre-existing condition insurance plan covers these kind of women that have been denied by their insurance companies.
Well, I guess what I'm suggesting is that this doesn't seem like the best issue to make your case. There may be a lot of good arguments for the Affordable Care Act. I refuse to call it Obamacare without the quotes, because I think that's obnoxious. But I guess what I'm asking is, are you just going to jump on any issue that you think you can just get your way into with Know Your Care?
Well, all the issues are important. I mean, domestic violence, don't you think it's an important issue?
Of course. Don't suggest that I don't.
Preventive services for women, all of them are issues. This is just one of them. I mean, children issues, also school-based clinics are a huge issue. So should we not pick on that? Of course, we need to talk about that. The issue is that Nevadans do not know what Affordable Care Act holds and all the benefits that they could provide. And if you don't know, like senior citizens have so many preventive services right now that they're not taking advantage because they don't know about it.
Are you suggesting I'm a senior citizen? Is that why you brought that up? I want to take a break, though, because I think the overall point is people really don't know a lot of what's in the Affordable Care Act because of the message war. And I want to talk about why this group was formed and what your goals are right here in Nevada. We're back to talk about the Affordable Care Act, and I will not say Obamacare without these air quotes. I love these air quotes. Back in a moment.
John Ralston wants to hear from you. Call 702-633-8748. Send an email to John at ralstonfacetoface.com.
Welcome back across Nevada to Face to Face. I'm sure you've heard about all the criticism of the Health Care Reform Act. It's been going on now for a couple years since it was passed. Well, the administration and its allies are finally fighting back. KnowYourCare.org is just one of many groups that have been formed to try to present what they say is the real side of the story. And we have a representative of KnowYourCare.org on the program tonight. Annette Ravaneau is here. So that's really what happened, isn't it? I mean, there was some feeling among people who support the Affordable Care Act that the message wasn't getting out, right? That things like whether it's domestic violence screenings or other elements weren't getting out as much as, let me just pull something out of here, death panels were, right? This kind of stuff. And so this group was formed, the nonprofit. It's one of several, I believe, that are formed. Now, what are you going to do? You're going to try to come on programs like Face to Face and educate the public? You're going to do TV ads? What are you going to do?
Well, we are already, since this summer, we're doing several events, seminars at senior centers. We're educating the seniors about Medicare and what is it that what kind of coverage do they have now thanks to the Affordable Care Act that they did not have before, all the savings that they are getting right now. Also, schools, school-based clinics. Also, there's a lot of funds that are going to be going to the schools, preventive services for women, the pre-existing condition insurance plan, which is huge. It's right now going active. You could apply for it.
And that is the most popular part in some ways of the Affordable Care Act, that you can't deny for pre-existing conditions. But let's be honest. Let's live in the real world here. You go to a senior citizen center, you go to a school, and they say, oh, that nice lady came and told me all those things. And then for the next year, they see ads, millions of dollars, maybe tens of millions, hundreds of millions of dollars spent on telling people this is $1 trillion tax increase. They're going to cut Medicare. You can't compete with that.
Well, that's why we're going to them. We're going to them, and a lot of them have told us, I've sent money, cash, in a envelope because they said they needed it. And they use tricks. But as long as we talk to them, we educate our community, that's the only thing we could do, is just educate our community, engage, and of course, come to shows like yours.
We did some of this on the intimate murder, domestic violence aspect. Is it mostly women you think that need to be educated, or is it both women and men you think need to be educated on this?
Well, both of them definitely, but a lot of women don't have the access, either because they don't work or because they're home with the children, whatever the reason is. A lot of men or their partners just use different tactics to control them. It's all about control. And when the woman now does not see a way out, she does not know of all the organizations that are out there, like Safeness and all the organizations that can help them, they don't know, therefore they just get stuck.
We are out of time. KnowYourCare.org. I hope you'll come back and talk about this as the year goes on. Thank you so much. And on the next Face to Face, more of the issues that matter to you from people in the know. Thanks for watching, everybody. Have a good night.